Only the people can liberate themselves
from AIDS, the epidemic.
The district of Hertzibande in Mpumalanga province is characterized by vast farming areas with hubs of economic activity such as mining and power stations, the major industry being Sasol synthetic fuels in the Govan Baki sub-district. This area has the highest population in the district and draws a lot of migrant labor from other provinces and neighboring countries.
Hertzibande as a whole is a mining district. We have a lot of mine and we have a lot of trucks passing, coming in and coming out, and we have a lot of migrant workers. Most of the people who are in this area, they are not from this area. I can say maybe in percentage, 75% or 80% they are not from this area. They are from Eastern Cape, they are from Limpopo, they are from Northwest. So some they are from Zimbabwe, some they are from Swaziland. So we have a lot of migrant workers in this area.
These characteristics of the district pose a challenge for effective disease management such as tuberculosis, as continuity of care cannot be guaranteed with the high migration of people. According to the 2011 National Antenatal Sentinel HIV and Syphilis Prevalence Survey in South Africa, the Hertzibande district has the highest HIV prevalence with a population of around 1 million people.
I think our area is one of the highest areas with prevalence of HIV and AIDS, as concluded by the ANC survey. I think we are sitting around 38% at the moment. And that is a cause for concern in that for us to manage the HIV and AIDS issue, obviously we know the baseline for that is HIV testing.
One of the worst hit by HIV and TB is sub-district Govan Beki. This is one of the areas where we operate TCE, total control of the epidemic. After these surveys were released, the district showed determination, and immediately the municipal council approved an HIV and AIDS strategy and implementation plan for 2012 to 2016 financial years. It has been rolled out to all local municipalities and all stakeholders during 2013, 2014 and 2014-2015 financial years.
Where more people have been reached since TCE was here. So in terms of target and in terms of dissemination information, I think it's their role. It's very helpful and it complements our work around HIV and AIDS issues.
To date, 150,000 people are on ARV treatment in the district. 20,000 babies are being born HIV-free thanks to the PMTCT program. 300,000 people are tested for HIV, and furthermore, fewer than half of the patients screened for TB eligible for treatment were initiated on antiretroviral treatment. It is clear there is still more to be done in the fight against HIV and AIDS and TB in the district. The nature of the epidemic has changed and new strategies and tactics need to be employed. Humana People to People in South Africa and Foundation for Professional Development, through funds from USAID, introduced the CBCT program to address the situation in the Hertzibande district in 2015. Total Control of the Epidemic, TCE, is a unique systematic approach to empower communities in the fight against HIV and AIDS and TB. The aim of the program is to reach every single person in an operational area of 100,000 people through door-to-door campaigns, individual counseling and community mobilization. TCE starts by mapping and target areas with the highest HIV and TB and related health burdens. The TCE program works closely with clinics and other local government departments and organizations to secure those who test HIV positive are linked to care and treatment.
They started last year in our municipality doing the door-to-door testing, which is they are intensifying the testing, which is our main focus. By the way, we have a very, very good relationship with Humana. We are seeing reports to the municipality on local AIDS council. They're one of the stakeholders that we have. Yeah, we have a very, very good relationship with them.
All the people being tested are also screened for TB, and those suspected of having TB are referred for TB testing. Through this program, 105 trained field officers are working in trios of 3 to 5, targeting pockets of people, doing home-based campaigns, testing and counseling and screening for TB and STIs, and linking people testing HIV positive to treatment and care, and TB suspects to TB testing. Field officers institute the trio system for drug adherence by facilitating that patients on ARV and TB treatment identify 2 people to support them and cope with their respective medical regimes. Results during the first year period carrying out community-based HTC: 61,766 people were tested, 5,601 people tested HIV positive, or 9%. All tested HIV positive were referred for CD4, care, support and treatment. 1,800 people tested HIV positive, have completed linkage and are on ARV. 1.5 million male condoms were distributed. 183,000 female condoms were distributed. TCE is founded on the philosophy that only the people can liberate themselves from AIDS, the epidemic. Humana People to People would like to thank the passionates, the dedicated TCE field officers, and the TCE leadership as they have taken their tasks to heart. The motivated officers led by TCE troop commanders and special forces, the very supportive staff in the health clinics, and the people of the Govan Mbeki area are key to the success of TCE total control of the epidemic. Lastly, we would like to extend our gratitude to our partners, Community Based Counseling and Testing, USAID Foundation for Professional Development, and the Department of Health at national and provincial level, and not least Kurt Zibande District Municipality for their valuable contribution to the fight against HIV and AIDS, epidemic and TB.